Hello, you are welcome to another episode of Consulting Room 5 with me, your host, Dr. Sue. Today we are talking about emergency medical services. Recently, there have been growing concerns about response time and quality of care given by our ambulance services. We are addressing the issue of the right use of ambulance services, when to call in for it, and access to it on time, and the basic necessity to ensure our community and individuals have access to the best possible services by the National Ambulance Services. I have with me in the consulting room, Director of Operations for the National Ambulance Services. We will be right back after the short break. Stay tuned. You're welcome to Consulting Room 5 with me, your host, Dr. Sue. With me is Dr. Foster Anson Bridjan, who is the Director of Operations, National Ambulance Service. He's also a chartered member, Chartered Institute of Logistics and Transport, Ghana. He is also a member of the International Association of Emergency Managers. Doctor, you are welcome.
Thank you.
You're so welcome to this program, Consulting Room 5.
Thank you.
Yeah. So we all know that ambulances are used for emergencies. You call and then you are picked. But in Ghana, we see them carrying dead bodies, carrying foodstuff. Is it right?
Well, thank you very much for the question. Before I answer your question, let me express my sincere thanks to my boss, Professor Amenu Zakaria.
Oh, Professor Zakaria, yeah, the CEO, yeah.
Who actually mandated me to come.
Okay. He's a friend.
On this show.
My sincere greetings to him.
Okay. And also to all National Ambulance Service staff.
Okay.
The emergency medical technicians who are risking their lives to save people's lives.
Okay.
So I want to greet all of them and also giving this opportunity. Let me start by saying that we have an ambulance and we have what we call a hearse. So an ambulance, as the name implies, is a vehicle which has been specifically designed or specially designed with the necessary medical equipment.
Okay. And
also manned by trained medical professionals to transport somebody who is sick or injured to a hospital. So that is an ambulance.
So every ambulance we see must have a medical personnel trained, and then some equipment to assist in first aid.
Yes.
That's it.
Yes.
Okay.
So that is what we call an ambulance.
Okay.
And so it is used only to transport somebody who is sick or somebody who is injured and transport that person to a health facility. So,
is it just someone who is sick or somebody who is in critical condition?
Well, so not necessarily critical condition.
Okay.
Because somebody may be at home and may be going for a review.
Okay.
And because of his or her condition, decides to request for an ambulance to transport him or her from the home or the residence to a health facility. It may not be an emergency situation, but
Doctor,
needs an ambulance.
Does it mean that if one is at home and the person is not feeling well, or the person just wants to get to the hospital for a review, the person can call for an ambulance?
Yes.
Oh, really?
He or she.
But do we have that many vehicles to be able to take these responsibilities?
Well, it depends on who needs the ambulance.
Okay.
And where the person is located. If the ambulance is available, definitely the person can request for an ambulance, and they will definitely respond to him or her.
Okay, so you mean there are no specific medical emergencies? Anybody can call for an ambulance service and it will be available?
Yes. So let me try and explain how we operate. I think that will let the people understand exactly what we do.
Okay.
So for National Ambulance Service, we operate both emergencies and non-emergency cases.
Yeah.
When I talk of emergencies, then we are talking about critical conditions like somebody who suddenly collapsed, whether in a home or at workplace,
at an institution,
or
organization, wherever.
Yes,
yeah,
that is an emergency.
Okay.
During road traffic crashes,
Okay.
we call those ones emergencies.
Emergencies. Okay.
When somebody is in labor, a woman who is going
labor.
to is in labor,
Okay.
and they call for the ambulance service, that one is also an emergency. Or after delivery and there are complications and they need to transport the mother and baby.
There are referrals. If there are referrals,
yes.
then you
Such referrals are still emergencies.
Okay.
At the same time, we also run what we call non-emergencies.
Okay.
Like people are going for health work and they want an ambulance to be on standby or to follow them. So that in case somebody
unforeseen
conditions or situations, then we can quickly intervene and then ensure that we manage that case. Some people also request for, let's say, like a review, medical review. He's going or she's going for a review from his or her residence and requires the services of a national ambulance service or service of an ambulance. The person can still...
Just the medical review. So
yes.
let's say the person is either diabetic or hypertensive.
Yes. And because
the person is going for a medical review.
Yes. And where the person is located, maybe is far from the hospital, he or she can still ask for national ambulance service. And we even do discharge cases to homes. Somebody might have gone for, let's say, after a road traffic crash, they've done surgery,
amputation,
and he or she has been discharged. But the question said that he or she cannot sit in a normal vehicle. Then they can also still request for an ambulance, and we will provide that service.
It looks like your services are very broad than we all imagined or we all anticipated.
Yes.
So we didn't know.
That's why
I only thought that, that's why you are here. That's why you are in Consulting Room 5. You are telling us about how your services are operated. Yeah. So we are with the Operations Director of National Ambulance Services, and he is telling us about how they operate, the national ambulances operate within the country. So are there ambulances in all the regions?
Yeah, so as we speak now, the entire country, we have 297 ambulance stations.
Stations?
Yes.
Okay.
And each ambulance station has an ambulance.
One?
Yes, one ambulance. So we are in all the districts.
And what you are telling me, if somebody has to go for a medical review and the person calls for the ambulance, just one ambulance, can it serve the whole community? Definitely,
it is not enough, but at least we now have an ambulance in each district. Okay. So our operation says that all calls go to our dispatch center, and every region has its dispatch center.
Okay.
So when the call gets to the dispatch center, the one in charge of the dispatch center will interrogate the caller to find out what condition and where the location of the patient. And so having gotten that basic information, then he or she will decide which ambulance is closer to the location of that incident, and then they will dispatch that ambulance to respond. So if that ambulance leaves and there is another case within the same district or that town, it means the dispatcher will have to look for another ambulance which is the nearby district closer to that area, and then they will dispatch that ambulance. So basically, that is how it happens. Even though, as you said, we are not saturated enough to be able to respond to every case.
Every call.
But at least we are managing what we have until we get more.
Doctor, even though you're on set, I want to know the qualifications of the people, the drivers or the staff who use the ambulance and their roles. What are they supposed to be doing? All right.
Thank you very much. We have...
You're on set, so I want you to tell me.
Yes, we have 3 levels of training for our personnel. We have what we call the emergency medical technicians. They are high school graduates. And so their training is 1 year. Classroom, and then also they will go for clinical attachment at health facilities and also ambulance station attachments. So after the 1 year... Is it
an HND? Is it a degree?
No, the high school graduate, that's for the basics. Medical technician, that's the basic. So they are high school or let's say HND below degree. And any other qualifications equivalent to that. And so they will go for 1 year training. When they pass out, then they are posted to ambulance stations as emergency medical technicians. And then we also have the advanced emergency medical technologists. They are graduates, first degree holders and above, who also go through training for 2 years. And then when they pass out, they are also posted to ambulance stations as advanced emergency medical technologists. Okay. Then we have the third level, the highest, which is the paramedics. Okay. So having been trained as advanced emergency medical technologists for a number of years, having worked for a number of years, then you can go to be trained as a paramedic. But currently, we don't have, our training school does not train paramedics. So they have to go outside the country to be trained. So that's expensive. Very expensive. So we are unable to turn out many people at the same time. But for the basic and the advanced,
so those who drive the vehicles are mostly at the basic level?
Yes. And they are, for us, our personnel are not just drivers of ambulance drivers. They are fully trained. So whether the person is driving the ambulance or the person is in the patient compartment taking care of the patient, they are all trained. And so the driver can become an attendant at the compartment to taking care of the patient.
That means at every point, there are 2 drivers.
They are not, we don't call them drivers. They are emergency medical technicians or emergency medical technologists.
Technologists who drive ambulance.
They can still drive the ambulance and they can also
assist other
and take care of the patient. So we don't want to classify our personnel as, say the person is driving, it means he's ambulance driver. No, they are above just driving the ambulance. They have the skills to take care of a patient.
So how do I locate an ambulance?
Okay, so when someone needs an ambulance, the only thing that the person has to do is to call our emergency line, which is 112, the national emergency line, 112. So if you dial that number, it will go to our dispatch center. Somebody will pick your call and then interrogate to find out what has happened. So they will ask few questions. And we want to appeal to our viewers and also the public that they should exercise patience and let the person or answer the questions that the person will put to them. Because that will help us to know, one, where the person is located or the incident is located, the kind of or the condition of the patient. Because that will let the person who is receiving the call know what kind of ambulance to dispatch. It may happen that the person's condition requires that the person needs oxygen. So if the nearest ambulance is exhausted of oxygen, they will not dispatch that ambulance to respond. They will make sure that any ambulance coming to pick the patient or coming to manage the patient has the requisite equipment and then the logistics that is needed to take care of the patient. So they will ask you a few questions, your name, your callback number, because they may have to call you again. It may be the number that you are using to call may not be even your number.
Because it's an emergency.
Yes, so they will ask you a callback number, and then they will ask you the location of the patient and also the condition, what has happened. Based on this, then they will dispatch an ambulance to respond to the call. So all calls will get to our dispatch center.
What number can we use to call the ambulance service?
That's what I said, that the 112.
Ambulance services number is 112.
And this is a national emergency number. So sometimes you may call the line and it may delay. The reason being that if our dispatch center line is engaged, the call may route to fire service. And they will take the call and then they will transfer the call.
Why will it route to fire service?
Well, the 112 is a national number. So wherever fire service, police, ambulance, we are all on the same number.
It's a different number?
No, for now, the emergency 112 is national
emergency number.
Emergency number. And so it can go to any of these institutions or organizations: fire service, police service, national security, and then ambulance service. You can
same 112.
Yes.
But is Is it good?
Yeah, you know, emergencies, it can be any form of emergency. It can be accident, it can be, let's say, fire, or even robbery, where you need police assistance. So nationally, we have one number to cater for all forms of emergencies. Even though, apart from that, all the other institutions has also their different numbers that you can also reach them on. So for ambulance, we also have another number that I can give out.
So can we do that?
You can use that one also to reach. Say this one is a full number, so it's not a short code. So that one is
so
not
this
a
short code can go to either fire service, police service,
yes,
national security,
yes,
or the ambulance service.
Yes.
But you have a specific
but the
number.
specific number for ambulance service. That one is 055
055
820
820
1496.
1496.
Yes. So that one will go straight into our dispatch center, where somebody will pick that call and then also take you through the same process, and then an ambulance will be dispatched.
You know, sometimes when you call them, they ask for some monies before they come.
That's why, that is a perception that is out there, that ambulance,
for fuel,
call them, they always request for. But no, it's not true. I have already explained that we run two types of cases, emergencies and non-emergencies. All the emergencies that I mentioned, be it road traffic crash, sudden collapse at home, labor, child health, all those things are free, completely free. If there is a road traffic crash or somebody collapses in your workplace and you call for an ambulance, they ask you to pay money, then it means that person needs to be brought to book. Nobody will ask for money for such emergencies. However, imagine your mother or your brother is in a hospital or somewhere, let's say Cape Coast, and then they want to bring that person to Kolebu for referral. All the interventions, the services that we will render to that patient in the ambulance is still free. Even if the person is on oxygen from Cape Coast to Kolebu, all that will be done are still free. The only thing is that because our fuel is reserved for rare emergencies, because when there is a road traffic crash, you cannot say that there is no fuel in the ambulance. So such cases, they will say that support them with fuel to enable them to transport that patient to Kolebu. That is where money comes.
How long can one be in an emergency ambulance?
For the duration, we cannot give timelines to it. Because sometimes we transport cases from Tamale to Accra. And so as long as the person is in the ambulance and the distance have not ended, the person will still be in the ambulance. The only thing which is better than using other vehicles, that in the ambulance, the person will be taken care of. Medically, somebody is there to monitor all the vital signs to ensure that the person is stable. If there is the need for any interventions, the person will be taken through. And then, because those in the ambulance are trained, so they'll be able to provide the necessary interventions whilst
to sustain the person.
Until we get to the health.
So you mentioned earlier that there are heads and then ambulance.
Yes.
So do you manage the two, or do you operate?
No, for hearses, there are individuals that run hearses. As you go to Kolebu Mortuary, you see plenty of vehicles over there. Like, those are for individuals. And for ambulances, even though National Ambulance Service, we are operating the national one, but there are still individuals who also run ambulances, like health facilities, private health facilities. They have their own ambulances that they also use to do their referrals from their facility to other hospitals. So those are also there. But we run the national one. So
the National Ambulance Service, you run that one?
Yes.
You mentioned some two numbers. The one that is mainly for ambulance service. Imagine somebody is calling from Tamale, another person is calling from Tema, Accra, and all others. How would it get to them? as early as possible.
So in the regions, they also have their individual numbers, which they have actually publicized in the regions that people can reach them on.
Okay.
Because every region, we have a dispatch center at every region. So they run...
I think that you have to give me that information so that I put it on. So I can put that information on the screen as we show, so that all other regions, because this channel takes care of the whole region. And so
that's why I have given the emergency code,
okay,
which is the 112. That one is the simpler, because if you give wrong numbers,
112 takes care of national security and all others.
Yes, but that one is very effective and efficient, because wherever it goes, somebody will pick your call and then redirect the call to the appropriate agency.
How long does it take before a call is picked up and then it's being responded to?
Oh, it depends on, as I said, one challenge that we have, maybe I may have to bring it out now, even though you've not asked that question, is the prank calls, where somebody
I was actually going to go into the prank.
Somebody without having any emergency decides to call the line.
Okay.
So if you call the line, there is no emergency in your area, and you call the line, and somebody will definitely have to pick the call.
Yeah.
So when it happens that way, you engage the line. So when rare call comes, you see that the line will be engaged. And so that is why we have this across all the agencies. So if National Ambulance Service line is engaged, instead of you still be calling and be on waiting, then the call will be routed to another agency, like the police or fire service.
Okay.
So they will pick the call there, and then ask you few questions, and then quickly they will, as they ask those people, they will be typing it into the console. And by the time you finish, they have also routed the call to the ambulance service, so that they can take
So when they take it to the ambulance service, then you also take it to the area where the person is calling?
Yes.
Is that so?
Yes.
Okay.
So sometimes the case may be in, let's say, Kumasi, Tamale, Takoradi, but the call may be received in Accra. Definitely, since they have all the emergency lines of the various regions, they will quickly refer the call to them, and then they will take them.
So is it a 24-hour service?
Yes, we run 24 hours.
2 a.m., 1 a.m.
Any time you call, somebody will pick your call. So that's one, rest assured. Yes.
National Ambulance Services.
Yes.
Are there challenges that we can discuss here?
Yes. One major challenge is what I have just
mentioned.
The prank calls. Is unbearable. Because people, since it's a toll-free line, people...
When they're even bored. People are bored, they just want to call.
Call the line.
Oh, no.
And a whole lot of things happen. I have worked in the dispatch center before as head of dispatch, and sometimes the words that will come out from somebody who called the line is said that I can't even see some of them here.
Why? Why?
Just for fun.
Oh, no.
Just for fun. They may even call, and if a lady plays the call, somebody will say, oh, I like you, those kind of things. they say all sorts of things. So we are appealing to the general public that it is an emergency line. You don't know when somebody who is in dire need of an ambulance will be calling, and then you have engaged the line, saying all sorts of things, making fun of the people working at the place. So if you don't have any emergency, don't call the line, because you don't know. It may be your uncle somewhere who needs the ambulance.
Who needs the ambulance, and then you will be there, and then you engage the line.
So that
so
is
what should one say when?
We are actually appealing to the general public that they should desist from calling the line if there is no emergency. And so that is one major challenge that we have. Another one is the congestion on our roads. You know, the ambulance, when moving, we have what we call response time. We need to get to where the incident is at the shortest possible time.
Yeah.
And internationally, we are supposed to work in less than 10 minutes to get to the scene. But here we are, 20, 30 minutes, you are still on your way trying to respond to a call. And you know, some people, or some road users, not all, but some believe that if the ambulance is heading towards a direction where there's no health facility, they may think that they are just on their way out.
But sometimes, you know, doctor, sometimes there is nobody in there. they are not going anywhere. You follow them and they are going
in,
to a nearby restaurant to go and eat.
That is when they may be going to the incident scene.
Sometimes you follow them, you see they will branch somewhere and then they are going to take some snack or lunch or dinner.
Not at all. Our people are well trained and they are professionals. So they will not abuse the ambulance in that manner. So I'm also appealing to other road users. Other road users, that when they see the ambulance coming, irrespective of the direction, they should open up for them to go. They may be now going to pick the patient. Okay. Or they may be going to accident scene.
Okay.
So allow them to get to the scene on time, because we believe in getting a good response time. Because, you know, especially when it comes to road traffic crashes, we have what we call the golden hour. At the time the incident happens, getting there on time, picking the patient, managing the patient, getting the patient to the hospital for if the patient needs surgery to be done, all within 1 hour.
It's the golden hour.
Yeah, that's what we call it.
Very special.
Very special time that if you
miss it,
the person may lose their life.
Yeah.
And so they should allow us so that we'll be able to meet that golden hour to save somebody's life. So open up for us. Don't think about where they are going.
We should just open so far as it's an ambulance.
Yes, because you may not know where they are going. It may be to your house.
Yeah, or a friend or a nearby.
So it's very important.
But doctor, I saw one ambulance on the social media, and they had packed cassava. Did you see that one?
Oh, that one is an exaggeration. You know,
I saw that on the social media.
There was no cassava. So, but anybody who said that the ambulance is used to carry cassava.
So was it a photo?
See, that incident actually came to our attention, and we actually investigated it. It wasn't that the ambulance was being used for carrying unnecessary or contraband goods. You see, the team came to Accra with an emergency. They were going all the way north. And so they passed through office, and then they were given some consumable that they are going to use in cleaning the ambulance and also for operational things. That is what they saw, that they said there are a lot of gallons of liquid soap and other things in the ambulance. And then on their way going, you are going all the way up north. So the people stopped by just a bunch of plantain on top of those things. And they said, at least the people will eat.
They have to eat.
So that's why it was an exaggeration. It was an exaggeration.
They are also humans like us. They have to eat. They have to buy something.
So sometimes we also appeal to the public that they should empathize with us to see that the kind of work that we are doing,
it's more sacrificial, risky.
Yes, people are risking their lives. So sometimes if they put those kind of things on them, it's actually demoralized them. As if they've done something.
So you don't think that some of your staff might also be abusing it?
Oh, definitely. You know, as any human institution, definitely there are, as they say, every home there is a Mensa there.
It's not anybody called Mr. Mensa.
But once in a while, you may get 1 or 2 people who may go out of the wayward. And we try to bring them online.
So but also with the general public, if they see that some staff are abusing the ambulance, do you have a number that we can call to? Oh,
yes. If you observe any of that, such a thing, definitely you can call and then we'll take it up.
We should call the same number
the same number will go to the dispatch center, but you can also call my line.
Your line?
Yes.
Your personal line?
Yes. We also work 24/7.
So would you like to mention your line too?
That can be done. But we have an official office line.
Yeah.
That I can also.
Yeah, I think you should rather give the office line out so that if there are any of such abuses, we can mention it to.
Even if you can even send an email to info.
So you give us all those information.
info@nas.gov.gh.
info@nas.gov.gh. So info@nas, NAS.
Yes, NAS.
.gov, like government. .gh.
Yes, that one.
You send an email and it will be responded promptly.
Our secretariat is very efficient, and then they will respond to it.
Yeah, because we want things to work. Yes. We want measures to work. Emergencies, as you said, the golden hour.
Very, very
if we
important.
miss it, and that is why most of the time people lose their lives, because we miss the golden hour, right?
Yeah.
Yeah. So if we see that there are any abuses of the use of the National Ambulance Service, you can send an email to info.nas.gov.gh and
info at
the at sign,
yes.
info@nas.gov.gh
or 050
050
161
161
48
48
77.
77.
That will go to our secretariat at national headquarters.
The national headquarters, and they will deal with the
they will
people.
also
But how would they know that? Or they should just mention the number of the ambulance.
Yes, you can get the number, the location where it happened. So far, you give us the number of the ambulance, we will trace it, because operation will definitely get to know where the ambulance is coming from, and then you will take it up.
So we're talking about the challenges.
Yeah. So another challenge we have is the road network.
The road network.
Yes. You know, certain places, the ambulance will need to move a bit faster.
Okay.
But the road condition is such that movement becomes difficult, and it affects our response time, as I said earlier on. And at the same time, also the vehicle itself is also affected. And even the patient in the ambulance is also affected, especially if the person is a road traffic crash and has a suspected spine injury, and on such roads and you need to move, it becomes difficult.
Yeah.
So that is also another problem that we have.
Right.
And when it comes to our general operations, those are some of the things that actually affect our operations. So the congestions, the prank calls, and then the road network are the basic things that...
So they are you know, with the three you have mentioned, the prank calls are the ones that we can immediately fix.
Yes.
That's one, deliberately people do that.
Yeah.
So if we are able to tell them to, encourage them to stop that prank.
We are trying, so that's why any platform that we have in the media space, we try to bring it out so that we educate the public for them to know that it is not good. Because the ambulance service is an emergency service institution, and if you block their line or you actually call in to engage the line, you are actually causing harm to somebody who really need our services. So they have to desist from that.
So are there some other informations that you would want to tell us about these services?
And the only thing I also want to say is that for ambulance service, we also do trainings for public institutions like Joy FM or Joy News team or multimedia team in general. You can request for basic training for your personnel. And we'll come and train them.
On first aid?
Yeah, on first aid and basic life support.
So
that in case there's an emergency here, before you call the ambulance team for them to come here, because as I said, response time, it may delay coming to all this, or even when you are calling, somebody has engaged the line through prank calls. So at least, if you have a team on standby who has skills in first aid, they will be able to at least attend to the person whilst you reach the ambulance service for them to come and actually take over.
I think it's mandatory.
Yeah, so it's something that we are doing for a lot of institutions. And
so just as we do the fire drills, we do the emergency training, evacuation drills and all that. So it's also important that we get into our organizations and institutions.
Yeah. And ambulance services are always available.
Is it for free?
Just call, something small will be taken because we have to give them certificates and other things.
Oh, wow. Okay, that's good.
So you will definitely come, we train them.
So what will the certificate entail?
Well, that makes you a first aider. What will it
entail? Like first aid?
So Dr. Siu has been trained as first aider or something like that, so that you can also come out and say that this institution...
You can put it on your CV.
Yes, it becomes part of your CV and it shows that you are trained and you can actually provide first aid or basic life support, especially basic life support. You know, it is something that it is very important. Because if somebody should just collapse here and the person needs CPR, when there is no
body,
pulse and there's nobody to do that, the person will die.
Will just die.
So at least having that skills, basic life support skills alone, is something that every Ghanaian must know. Because in your home, it can happen that your father, your mother, or your brother just fell down and then become unconscious. You check the pulse and there's no pulse and you don't know what to do. Before you realize, you call ambulance and by the time they will go through this traffic and reaching your home, the person has already gone. So it's something that we need to know. And so we are trying to train and educate the general public for them to know the importance of basic life support. We are even hoping that it will go to our schools. Okay. And our people have started even training some school children during certain periods. And so we want to make it a general thing that every school, if they open up, our people will come, train the students on basic life support and basic first aid as well. Okay. So that gradually the entire country will have people who know what to do.
At least will be knowledgeable about that. Yes. Oh. Thank you, Dr. Foster Bridgen. We are taking a break, and after the break, we are going to discuss more on the responsibilities. Are there ways of collaborations, and also the basic life support he's talking about? What exactly are they? He would give us brief information about it to entice us to always call them to come to our institutions for the training. We are with Dr. Foster Bridgen, who is the Director of Operations of National Ambulance Service, Ghana. Stay tuned, don't go anywhere. We'll be right back. Welcome back to Consulting Room 5 with me, your host, Dr. Sue. Today we are talking about ambulance services and their operations. We are with Dr. Foster Bridgen, who is the Operations Director of the National Ambulance Services. Doctor has told us about how the ambulance services operate and the hotlines. He has given us the hotlines. He has also told us how we should give the ambulance services the space, the enough time and all that so that they can operate well and respond promptly. He has also mentioned that they do trainings for institutions, organizations on how to save lives immediately, so that when there are emergencies, we can start with those things before, for sustainable, before there is an arrival of an ambulance service. So he's going to tell us immediately, or is it immediately after the ambulances are dispatched, that we should expect, or at what time do we expect an emergency call from the ambulance? And also, are they going to call us back if we call for the ambulance service?
So as I explained earlier on, the personnel at the dispatch center are also trained.
Yeah.
So they know what to do. So that's why they will ask you questions. So imagine you call them and you say that somebody just fell down at the office. Then they will ask you, they will take you through some questions.
Okay.
Is the person breathing?
Okay.
Maybe they will tell you, put your 2 fingers at the side of the apples to see whether there is a pulse.
Okay.
What we call the carotid pulse.
Okay.
So they will ask you some of these questions. If there's no carotid pulse, and then it means the person is almost gone. So they will tell you what to do by starting the CPR.
Okay.
That is why you should have trained personnel at the office or at the institution.
Yeah, yeah.
So
You will tell us what the importance of getting to know all these CPR, life-saving emergencies and all that. You are going to tell us, but not now. Okay. In few minutes.
And so the personnel will direct the caller If the caller is with the patient, then they will take you through what you need to do for the patient at that time, whilst the ambulance is on its way to the location. So that is why that time difference will...
Do they call back if they are finding difficulties?
Yes, that's why they will ask you for your call back number. And they will ask you for your call back number, so that while the ambulance is on its way coming, they will call you back to tell you that, oh, the ambulance is coming. And within the next 5 or 10 or 15 minutes, they will reach your location.
How do they get to the location? Do they use Google location map? Do they use...
Well, for now...
the kiosk at the back somewhere?
When they ask you, they will try to find out if you can give them a landmark.
A landmark,
That will help. Even though we are also moving to that, where they will use the GPS system to actually locate. Actually, we started and then at a point, we had some challenges, but we are going back.
Challenges like how? Born before computer?
No, not on the side of it. It is the system that they were using. That was some challenges that we are trying to rectify. So that, so all the ambulance were having some GPS system that you use in locating. And so when they are able to get it back, that means they will just take the GPS address and then they will drive straight to your location. So that is what is being done at the moment.
So at the moment, we say that when you get to the watches seller, turn left, and then some kids are playing football somewhere. So days that it rains.
The dispatch center also has the map of, let's say if it's Accra, you have the map of Accra at the dispatch center. And so there are specific areas that are earmarked on the map. And so they will use that one to direct the... and you know, we've already said that the ambulances are in the district. So if you come to Accra, all the metropolis or the municipals,
they have at least
one ambulance there. And it is also the responsibility of the ambulance team in those municipalities to do their own familiarization tour, to know the topography of the area. So the moment you call and you mention the area, since they've done their own survey of the area, they know exactly where they are going. So it helps.
Oh, okay. So would you like, I mean, from the whole ambulance service, are there ways of collaborating with some other health facilities or organizations who would like to do some collaborating?
Actually, we don't work alone. Because when it comes to road traffic crash, for instance, we move, ambulance, fire service moves, police also moves, because we need to work with all these institutions, even including NADMO.
Depending on the...
depending on the incident. So when it comes to road traffic crash, for instance, the police are supposed to be there to cordon off, to protect the area for us. National Fire Service is also supposed to come and do the extrication if there are patients or casualties trapped.
If there are road traffic accidents?
Yes, road traffic crash. If there are people trapped, they have to clear so that we can actually get the patient, and then we will manage them and then send them to facility. For instance, fire service, when there are fire outbreaks, if you just last...
the Kumasi incident,
for instance, we have to attend to about 9 people who were involved in one way or the other, some out of panic, some out of this smoke inhaling. So all those things. There were even 3 fire officers who were there to fight the fire, got themselves also becoming injured, and they have to send them to a facility. So anytime
no
fire
one
service
lost
moves,
their lives.
Nobody. So anytime fire service moves, ambulance is also there, and police will also there. So that collaboration is already there. We also collaborate with even the armed forces. Because when it comes to high risk, imagine like counter-terrorism and those kind of things, ambulance service, we are also there. So we do what we call simulation exercises together. So that we train together. Everybody knows his or her role. And so every institution knows its role when it comes to this kind of things. So that's why we do simulation exercises. We work together so that we can work and then save whatever situation that we find ourselves. We also work with National Road Safety Authority, because they are on the road, managing the road issues. So we also work with them so that when it comes to going to educate the public, ambulance service also are there to also support in that public education, because whether we like it or not, while we want to prevent, definitely, that's why we call it is an accident.
Accident or emergency.
So it will happen. And so if it happens...
So you should prepare ahead of time. Right.
What do you do? Because normally it is other road users who will get to the scene to meet that accident. And so the driver's mates, and even the passengers, they should know what to do when they meet accidents on the road so that they can all assist in managing it. So this is part of the people that we work with, including even DVLA, also
MTTU,
yes, MTTU and all those people.
So these people you have mentioned are all government organizations and agencies. Are there private collaborators that you even expect that they come to join you, or you plead that they come?
So when it comes to private institutions, what we normally do is that, for instance, we also collaborate with cattle relief services, CRS.
Okay, so these are NGOs.
Yes. So in training and also support, they also support us in establishing some of our dispatch centers so that they also, because they are more into maternal and child health cases. So that we together, and Ghana Health Service, we all work together so that we can also help, especially when it comes to our mothers and people in the northern and other hard to reach areas. They also come in support.
To get there.
Yes. So those are some of our collaborators. At the same time, we also do work with other private institutions, especially when it comes to training of their people, for them to know what to do.
So we are back to the training.
Yes.
So can you mention some of the things that you train about?
Yeah, so
the CPR.
The basic one is the basic life support.
Basic life
support. When it comes to basic life support, we are talking about CPR, where we take them through how to resuscitate somebody who collapsed.
Can you demonstrate?
Describe.
Can you just describe it?
We don't have the mannequin.
I thought you were going to bring a mannequin to
actually, I didn't know what kind of... We would have come with a whole team to demonstrate. So maybe another opportunity will come.
We'll give you another opportunity to do that.
A team and the mannequins
for
actually
we'll
demonstrate that.
Right.
So when somebody collapses or falls down, and then the first thing is you rush to the scene. First, find out where... You have to look around to see where the person is safe. Because the person must be in a safer place before you can even assist, because your safety is also important. So if the person is not in a safer place, first you have to move the person to a safer place. Quickly, you check whether the
safe means what? Safe, the environment being safe?
Yeah, the environment being safe.
Like pollution? Is it air?
Pollution, but maybe the place is not conducive, maybe air, let's say fire.
Stuffy place.
Yes, so, so you have to make sure that where the person is a place that you can actually, because you're going to take some time to reviving the person. So if the place is not conducive, you may not be able to do that. And so you check the safety of the patient and the safety of yourself, who is going to be the rescuer. Your safety is also paramount. So you check that, and when that is done, then quickly you call for help. Because this you don't do it alone. You call for help. Call somebody
who has done a CPR training, basic life support.
You still call for help, because you alone cannot manage a patient. Because, for instance, you come and a lady is lying down unconscious, and a gentleman, you alone is on the person that you are going to do CPR.
You have a lot of
questions to answer. So you call for help, for somebody to come and assist. Once that person comes, let the person call the ambulance. Please call the 112 for an ambulance. So whilst the person is going to call the ambulance, then you will check whether the person is breathing by just looking at the chest movement. If the person is breathing, you will know.
So if the person is breathing, you see that the chest movement will just be going up and down. So
that shows that person is breathing. But if you don't see that, at the same time, you also try to open the mouth and see if there are anything blocking the airway. Because the moment somebody collapses, the tongue falls back and then blocks the airway. So you try as much as possible to see if you can open the airway by trying to tilt the head and lifting the chin to open the airway. At the same time, you are also checking the carotid pulse. You put these fingers here at the side here to see whether you can see the beat. If there are no pulse from this side, it means there's no blood going into the brain. That's where the person is going to die. So the moment you check this and there's no pulse, then it means the person is in cardiac arrest.
Serious danger.
And something must be done
immediately. Yeah.
That's where you have to actually put the person on the person will be on the back, and then you try to do the chest compression.
Chest compression.
And so, since you may not have the resuscitation valve mask around you quickly, maybe you have to do what we call the mouth-to-mouth by doing 30 chest compressions.
You should be sure that the person...
So you may try to get maybe a plastic bag, and then you use it as a shield.
Okay.
Then you can...
You tear the bottom.
Yes.
And then you put it...
Yes, and then you can blow 2 rescue breaths, and then you do 30 chest compressions. So that's what we mean by CPR.
Yes.
But once you try to do this, somebody assisting you to do all this, you have already called the ambulance long ago. Of course, you may not be able to complete this. So the ambulance team, when they come, they have other gadgets that, professionally, they'll be able to do that. So if you have this basic training at your facility or your home, then definitely the one that will receive the call at the dispatch center will also support you, direct you what to do. Just like I have explained, he or she will be telling you to do all these things whilst the ambulance team
gets closer to your place.
To the place, So that is it.
So it means that this should be done in all organizations.
Everybody
because
should know.
Accidents can occur at any time.
Everybody should know. Because as we sit here, somebody can just collapse here, and then if you don't know what to do, now, hey, call, then before they will come.
No, it happens. That's why there are a lot of mortalities. So
very, very important.
So I think that you should intensify your education so that people would see the need for all these things to be done, just as they do the fire drills. They also do the basic life supports for institutions and organizations. At what level? Is it JHS, SHS? Actually, what level?
Even primary school.
Primary school.
You can start from the primary school, because the class 6 child, some can even do this. Because recently, during last year, for instance, we went to Christ the King. And then...
Which is a basic school.
Yeah, basic school, where we took them through some of these things. So every year during our EMS week, and also...
EMS is what?
Emergency Medical Services.
Week. When is that?
Normally it's in May. So we go out there and then we train people about this. But apart from that, our teams in the various regions also visit some schools and also actually organize some of these trainings for them. We also go to...
How do you select your schools?
That one randomly, not specific.
But do you suggest that we put them in our curriculum?
I have read this issue before, and it was even reported in some of the portals that if at least basic life support is inculcated in our curriculum, right from basic school, I think it will help.
Because what you said is not rocket science.
Not at all.
It's something that if you are used to it, you can easily do that.
Because some places, it is a mandatory that everybody...
Places like other countries?
Yes.
Developed, I suppose.
That everybody, you have to know this. And, madam, it is for our own interest. We always say, my boss will always say that if you know how to do basic life support, and you don't train your wife, or you don't train your son or your daughter, the day you yourself
will be
down,
trouble.
Who will do it for you? So we have to do it. We train other people so that the day you find yourself in that situation, somebody else knows how to do it, so he will do it for you.
The person will do it for you, so that you not be the Messiah who cannot.
So it's very, very important. So we will continue to train and train and train. And so I'm putting this out there that institutions just invite us.
They wouldn't charge you?
Not much. Something small for some manuals and then certificate that is why, and then at least something for the trainers.
For the trainers to eat. Man must eat.
That is all, but it's not much. So don't think about the cost, but think about the relevance and the importance of it.
The importance, how is... So, Doctor, do you have any summary, something you want to tell us? Then we can...
In conclusion, I will say that National Ambulance Service is there for everybody. And for emergencies, it doesn't know who you are.
Yeah.
At any point in time, it can come.
Yeah.
So we want to appeal to the general public that they should support the National Ambulance Service.
How?
In terms of advocacy.
Okay.
See, if everybody is talking positively about National Ambulance Service, then they will know the importance of having an EMS in our country. So talk about the importance of having such an institution in our country. And we should avoid sometimes, if there is something negative small, then that one is blown out of proportion.
Okay.
Let's look at the
positive side
things that the service is here for.
Okay.
And we are here for everybody.
Okay.
So all that you need to do is when you have any form of emergency, be it at home or in your workplace, wherever, just call the emergency line 112.
Okay.
Somebody will pick your call, and
it
professionals will come
your
way to come and assist you. Thank you.
Thank you very much, Dr. Foster Anson Bridgen. Thank you so much for the information that you've given to us. And as he has said, we should say positive things about National Ambulance Service. They are there to help us. Emergencies, we don't prepare for emergencies. And the ambulance service, National Ambulance Service, is always available to assist us, to come to our aid. There are emergency numbers, as he mentioned, emergency service 112, which goes to all the national security services. It will be rerouted to the National Ambulance Service, and then you would be attended to. There are dispatch centers, which also has their number 055-820-1496. And that is also a dispatch center that if you need help, please, the prank callers, please desist from calling and talking about unnecessary things if there is no need for you to do so. Kindly call and then seek for services, the right services. If you see any ambulance somewhere that you think that is not supposed to be there, or that you think that they are abusing the vehicle, you can also call the complaint center on this number 050-161-4877, or reach them on email info@nas.gov.gh. info@nas.gov.gh. Thank you once again, Dr. Foster Anson Bridgen, for having time with us. You are in Consulting Room 5, and here we educate people. We talk to people so that they get the understanding, as anybody at all will get the understanding. And I think that you have delivered right on point. Thank you so much.
I'm most grateful.
I think that we'll have to invite you again for the demonstrations and all that.
That's why we will come with mannequins.
Your mannequins and all those things, yeah. So we are so grateful for having you this evening. We wish you all the best. And as the operations director, I pray that everything you do goes on well.
Thank you very much.
All the best. Thank you.
Thank you.
Thank you, everybody, for watching Consulting Room 5 with me, your host, Dr. Sue. We'll come your way again next week. Stay safe and stay healthy. Bye.